Hello guys, welcome to Medley and Life. In this video, we are going to learn about the differential diagnosis of membrane over the tonsil. Before we enter into the what are the differential diagnosis, we have to think about why it happened to the tonsil and what are all structures related to the tonsil and what is the causes of formation of the membrane over the tonsil. We have to think about the other causes. That is the differential diagnosis of the membrane over the tonsil. Let's enter into the one by one topic. Before the differential diagnosis, what are all causes may lead to the formation of the membrane over the tonsil? First, membrane tonsillitis, and second is diphtheria and Vincent angina, and fourth is infectious mononucleosis, and fifth is agranulocytosis, and sixth is leukemia, aphthous ulcer, and candida, malignancy, and traumatic ulcer. This 10 are most common membrane over the tonsil, which is that this 10 things are most common in the day-to-day life. So that's why we have to know about the 10 causes. First is membrane tonsillitis. We already seen in the acute tonsillitis. In acute tonsillitis, the membrane tonsillitis is the one of the stage after the follicular tonsillitis. So here it is the pyogenic organism. It is caused occurs due to pyogenic organism and exudative membrane form over the medial surface of the tonsil along with the features of acute tonsillitis. Before formation of the membranous tonsillitis, first it formed follicular tonsillitis, and the follicular tonsillitis there is yellow spots. This yellow spots coalesce to form membrane, that is membrane tonsillitis. Diphtheria. Unlike acute tonsillitis, it is slower in onset and less local discomfort. The membrane of the diphtheria extends beyond the tonsil. It not only affect the tonsil. In diphtheria cases, it's not only affect the tonsils, it beyond the tonsil. It means the membrane of the diphtheria we can see in the pharyngeal wall, soft palate, anterior pillar, posterior pillar, and even tongue also. And it is a dirty grey in color. It is adherent and removal leaves a bleeding surface. If we try to remove the membrane through the throat swab, it leads to bleeding. So urine may show albumin and smear and culture of the throat swab will reveal the Corynebacterium diphtheria. Then only we can give the specific treatment for the Corynebacterium diphtheria. And coming to Vincent angina. Vincent angina is insidious in onset, less fever and less discomfort in the throat. Membrane, which is usually over the one tonsil, can be easily removed, revealing an irregular ulcer on the tonsil. When we try to remove the membrane over the tonsil in the Vincent angina, we can clearly see in the irregular ulcers over the tonsil. The throat swab will show organism. The Vincent angina is mostly caused due to fusiform bacilli and spirochetes. You have to remember this, fusiform bacilli and spirochetes. And coming to infectious mononucleosis. Infectious mononucleosis mostly affect in young adults. Both tonsils are very much enlarged and congested, covered with membrane. Local discomfort is marked because the both tonsil is enlarged and congested and covered with membrane. Infectious mononucleosis enlarged and congested. Lymph nodes is also enlarged in the posterior triangle of the neck along with splenomegaly. In this infectious mononucleosis, when it give the we have to when we are give to attention to the infectious mononucleosis, failure of the antibacterial therapy. If the membrane over the tonsil, we think about it may be in the bacterial infection. So if we give the antibacterial therapy, the membrane is not cured, the membrane is not disappeared. So then only we have to think about the what are the other causes due to other causes of membrane over the tonsil. In this case, infectious mononucleosis, the blood smear may show more than 50% lymphocytes, which is about 10% atypical. The 50% lymphocytes shows in the blood smear and 10% is atypical. White cell count may be normal in first week but rise in the second week. The pulmonal test should be done in the infectious mononucleosis cases. And coming to agranulocytosis, it presents with ulcerative necrotic lesion, not only the one tonsil but elsewhere in the oropharynx. Uh, as like diphtheria, the agranulocytosis also ulcerative necrotic lesion. It's not only affect the tonsil but also beyond the tonsil, the oropharynx, soft palate, that's all thing. The patient is severely ill in the agranulocytosis. It is the agranulocytosis two types, acute and chronic. In acute fulminant form, total leukocyte count is less than 2000 cubic millimeter or even less than 50 cubic millimeter, and polymorpho neutrophils may also reduced up to 5%. In chronic or recurrent form, total count is reduced to 200 cubic per millimeter with marked granulocytopenia. And coming to leukemia. In leukemia, in children, leukemia may affect the children and also adult. If it is affect the children, most of the leukemia, 75% of the leukemia is acute lymphoblastic and 25% is acute myelogenous or chronic. While in the adult, 25% is lymphatic and 80% is non-lymphatic. Okay, if it is affect the children, the leukemia 75% cases acute lymphoblastic and 25% is myelogenous. If it is affect the adult, 25% is the lymphatic type and 80% is the non-lymphatic type. Here peripheral blood shows more than 1 lakh cubic millimeter. It may be normal or less than normal. Anemia is always present in the leukemia and progressive. Blast cells are seen in the examination of the bone marrow. Okay. And coming to Afton's ulcer. They may involve any part of the oral cavity or oropharynx like diphtheria and agranulocytosis, Afton's ulcer also. Sometimes it is a solitary and may involve the tonsil and pilus. It may be a small or quite large. It may be a small or it may be quite large and alarming. It's very painful in Afton's ulcer. And coming to the malignancy tonsil and candida. Uh, the membrane over the tonsil is due to malignancy of the tonsil, and the membrane over the tonsil due to candida. Why the candida is appear? Due to high steroid drug intake or due to opportunistic infections leads to candida formation in the oral cavity. We have to misnomer the membrane over the tonsil due to other causes, bacterial infection like that. If we correct the steroid therapy, or if we correct if we improve the immune system of our body, it always reduce the disappearance of the it decrease the appearance of the membrane over the tonsil due to candida. And coming to traumatic ulcer, the traumatic ulcer is any injury to oropharynx heals by formation of the membrane. For example, if injury of oral cavity due to with a toothbrush or pencil or fingering in the throat, it leads to any injury in our oral cavity. It is healed by formation of the membrane. The membrane appears within the 24 hours. And coming to the diagnosis of ulceromembranous lesion of the throat. That means if there any case uh, come to you with a membrane over the oral cavity, we have to start from history taking. And next, physical examination. After the physical examination, we have to take a total and differential leukocyte counts. Then only we can find it may be agranulocytosis, leukemia, infectious mononucleosis, neutropenia, and take the blood smear for atypical cells and throat swab and culture. Then only we can give a perfect and correct antibiotic to the patient for in diphtheria cases and candida infection, Vincent angina, and take the bone marrow aspiration or needle biopsy. And other test, pulmonary test or monospot test is also taken to find the other causes of the membrane over the tonsil. That's it. In this video, we are seeing the differential diagnosis of the membrane over the tonsil. That means what are all the other diseases causes the membrane over the tonsil. Membranous tonsillitis means angina, infectious mononucleosis, candida, malignancy, agranulocytosis, leukemia. That's things. Okay. And also we are seen in diagnosis of ulceromembranous lesion of the throat, how we are going to start the examine and what are all investigation we have to do for the membrane over the tonsil. That's it. Thank you. In previous video um, I'm told about the acute tonsillitis. In this video, differential diagnosis, and next video we are going to see about the chronic tonsillitis. Thanks for watching, and subscribe to my channel.